Beautiful people, I'm Dr. Lara, and I'm going to share with you my consultation lecture for pregnancy and children. Let's start from the beginning, shall we? So in the beginning, we've come from two separate cells, from two separate bodies, each containing half of the chromosomes of every other cell in the body. And as they join together in a woman's body, they exponentially multiply, and in less than a year, creates a whole nother human being. So the intelligence that knows how to do this really incredible thing, we call innate intelligence. It's a knowing within ourselves that knows how to do these really incredible things without ever going to school to learn how. Like, our lungs know how to take in oxygen amidst the thousands of particles in the air, and our digestive system knows how to break down the foods that we eat and use what's good for us and get rid of what's bad for us, and sometimes get rid of what's bad for us even quicker if it's really bad for us, all because of innate intelligence. Our heart knows how to pump blood through our entire system from that moment of conception to the end of our last breath. So this is an example of innate intelligence. So let's do some basic spinal anatomy. Our spine is hollow, made up of 24 ring-shaped movable vertebrae. When it's stacked up on top of each other, it makes a tube. Inside this tube goes the spinal cord, which is an extension of the brain. The brain and the spinal cord make up the central nervous system, which controls, coordinates, and organizes every organ, every muscle, every cell in the body. It is the first system to be created as we are being created, and from it all other systems come. It's also the only system in the body completely protected by bone, because it is the most important. Now, what do we deal with as chiropractors? We deal with what's called subluxations. And a subluxation is when you lose proper alignment of your spine. You're partially going to lose that brain-body connection, which means you're going to lose normal function of your body and ultimately may lose your health. I have done a separate video explaining very simply what a subluxation is. It's about 3.5 minutes. Feel free to check it out. We'll move on to the next slide. So, what can cause people to lose alignment? Stress is the number one factor. Physical stress, chemical stress, and mental and emotional stress. Traumas, toxins, and thoughts. So examples of physical stress: micro traumas and major traumas. What's the difference? A micro trauma is something little that builds up over time. It doesn't give you a problem until one day you're like bending down to tie your shoe and you can't get up again. Little things like talking on your phone all the time, clicking a mouse on a computer, sitting at a desk from kindergarten to college through work, heavy lifting, repetitive stress. These are examples of microtraumas. And of course, there's major traumas. Major traumas are essentially you're going about your day, everything is fine, something happens, and then you're not fine. Trips, falls, car accidents, pregnancy and birth are also examples of major traumas. As happy as these situations are, they are extremely physically stressful, both on mommy and on baby. Chemical stresses, examples would be chlorine, lead, fluoride in our water, GMOs in our food, pesticides in our food, pollution in the air from various pollutants from cars, from airplanes, chemtrails, from vape smoke, cigarette smoke, pharmaceutical, over-the-counter, recreational drugs. These are all examples of chemical stresses. Some of them may be helpful, but they are simply chemical stresses on the body. Now, the third one is emotional stresses. Emotional stresses, a lot of people don't really consider how their emotional well-being can affect their physical body, but it is a huge factor. People who are in an emotional state might tend to do something called stress eating, which might affect their physical well-being. Examples of emotional stresses would be watching the news. Usually if you're feeling depressed or anxious, You're probably seeing a lot of commercials in between these news reports for particular pharmaceutical, chemical stresses for those issues. I usually recommend turning off the news. Believe me, you'll still know what's going on. You'll probably know better what's going on. Social media, taking comments on social media a little too seriously is an example of an emotional stress. Holding grudges. It's like the expression is drinking poison and expecting someone else to die. It's good to let things go. Self-defeating mindset. These are examples of emotional stresses. Chiropractic, believe it or not, the approach that I take, which is very gentle, can help to heal these emotional stresses on a very subtle level. We tend to hold these emotional stresses in our physical body, and when our physical body is properly aligned, then we're not only aligned physically, but also our mental and emotional state also falls into alignment. So chiropractic can affect more than just your physical pain. So biogeometric integration, or BGI for short, is the gentle approach that I take. It works with the sacred geometry of the body, and it gently releases tension patterns through your system. So essentially what this means is, as you can see with the aligned picture on the left of my screen, I'm not sure which side it is on your screen, but you can see how everything is nice and aligned. So on the other side of the screen, you'll see one that's kind of lopsided. So essentially, if you come in to see me and you have lower back pain, chances are I'm going to find a subluxation in your lower back. But what I'm also going to find is a correlating subluxation pattern in each of the other geometric structures of your body. Sometimes lower back pain could be caused by a subluxation in your neck. So what I do is I don't just focus on the area that you're complaining about. I make sure that your whole spine, your whole system is taken care of and everything falls into alignment. So what this is called is a compensation. So we want to make sure that the subluxation tracks, because it creates like a track through your system. We want to clear that track and we want to make sure everything is in proper alignment. What this does is it helps to allow deeper patterns to emerge, deeper healing that needs to come up from the surface to be released. This also helps to break any, potentially it can break chronic pain cycles, bad habits. So for example, if you want to eat better, you want to cut out sugar, but oh, that sugar, you just can't help but crave it. Having your system in proper alignment, from my experience, I was craving healthier foods. It's like your body wants to be healthy, your body wants to exercise more. You may find if you want to meditate, it might help your meditation. So chiropractic can help with more than just back and neck pain. And this gentle approach I found from my experience is very effective. So pregnancy and birth, Webster technique. This is the technique that I am certified in. It is gentle, it is specific for pregnancy, and it helps to align the pelvis and release any constraint on your uterus. This helps to create more space for your baby to move and grow in its natural position. And I'll tell you a little secret. It used to be called the Webster breech turning technique because according to research, 85 to 91% of the time, women who got adjusted were able to, their baby moved into the most natural position. Now, does the Webster technique adjust breech positions? No. We don't take care of a specific condition, which is why we had to take that breech turning phrase out of the Webster technique. Essentially, what the Webster technique does is it helps to align your pelvis. It helps to align your pelvis and release constraint on your uterus. So what it would entail is I have you face down on these wonderful pregnancy pillows, which helps to release the tension in your lower back, which helps me to align your pelvis. There's not a whole lot of twisting and popping for pregnant women because you have the relaxin hormone running through your system. So your ligaments are much easier to adjust because they're much looser. So I adjust you very gently when you're face down by contacting your sacrotuberous ligament, which is right by your butt. So if you feel me poking around your sacrotuberous ligament, don't be nervous. However, if anything I do makes you uncomfortable, please let me know because I can modify my technique to make you more comfortable. I have other instruments that help me make that gentle adjustment. Then I'm going to have you on your back, and I'm going to release any tension in your round ligament on the opposite side. This makes sure that your uterus is in the proper position and is properly aligned within your pelvis. So what I do is I don't actually turn any babies. What I do is I create an environment, an aligned environment, so your baby has that space to move naturally. So there's many potential benefits. I can speak from my own personal experience. You have a nice, clear brain-body connection as your body is creating a whole nother human being. You will have a more comfortable pregnancy, an easier birth, and shorter labor time. These are all potential benefits. Your mileage may vary, but I can tell you from my experience, I got adjusted every week throughout my pregnancies, and my firstborn came out in an hour and 44 minutes. I didn't have any time to get to the hospital. I gave birth to him on the floor of my living room with 2 police officers present, and my husband said that he has never heard anyone scream at cops like that without getting arrested. So now we're going to move on to, should babies get adjusted? Yes, they absolutely should, because babies feel stress. They don't feel the same kind of stress that you and I feel. They don't have to worry about going to school or passing a test or paying rent or getting a job. But they do feel stress, as you will see from the list on the next slide. But some information, some trivia for you, I guess. The diameter of our spinal cord only grows about 6% in our lifetime. So the spinal cord takes up a lot more space in the spinal column of a baby than it would an adult. So misalignments are going to affect a baby more than they're going to affect an adult. Now, there's a blessing and a curse to this. The blessing is that babies have no muscle tone, so their bones can be adjusted very gently and very easily. The pressure of an adjustment for a baby is as light as the pressure I put on your eyeball or testing a tomato at the supermarket. It's a sustained contact, and it takes maybe 30 seconds to adjust, and it's really amazing the difference you'll see in your baby after their first adjustment. One thing I do for my pregnant clients is I include your baby's first adjustment in your care. If you choose to take advantage of it, of course it's completely optional, but I usually ask that you bring your baby in within the first 3 months just so I could check the atlas bone, and here is why. When and why should babies get adjusted? Now, mind you, they're not going to show any obvious signs or any obvious symptoms that they're subluxated or in pain. But as you can see, I hope my image isn't covering the picture, but there's a picture of the atlas bones that are sitting on top of the axis bones. Now, the atlas bone is a diamond-shaped vertebrae that sits on the very top of our spine. It is the first vertebrae, and it has no disc above or below it. So it can subluxate very easily. And as you can see, the birth process itself, whether it's natural, whether it's C-section, whether there's a vacuum extraction or forceps, it's going to affect the alignment of the atlas. Now, the atlas foramen, the hole right in the middle of the atlas, is larger than any of the other in the spine, because this is where our brainstem dips into our spinal column. Our brainstem, among its many important functions, regulates our breathing, it regulates our sleep cycle, and it regulates our digestion. And what do babies tend to have issues with? It's usually one or all of those 3 things. So birth is probably the most important time for babies to get adjusted, which is one of the reasons why I include it in my care. If anyone in the world was only to get one single adjustment in their whole life, it should probably be right after their birth. And at each milestone, which essentially is maybe once a month. So as your baby's lifting up their head, as your baby's pulling themselves up, learning to sit up, learning to crawl, learning to walk, teething, transitioning from liquids to solid foods. Anytime they hit that a certain milestone, is a great time to bring them in and make sure that their spine is in proper alignment. So, what stresses do babies feel? Well, here is a short list of stresses that babies feel from about birth to 5 years old. The birth process, whether it's natural or whether it's C-section, is going to subluxate the atlas. The change in environment from this warm, wet, sterile environment into this open-air, non-sterile environment can be very physically and chemically stressful on babies. Now, if they're born C-section, it's going to affect the bacteria on their skin because they don't pick up the flora from the birth canal on their way out. And their cerebral spinal fluid is not triggered in the same way. So if you can imagine a butterfly coming out of its chrysalis, it's got to struggle a little bit, which gets that blood flowing to their wings so their wings can fill with blood or fluid and they can fly away. Opening up that chrysalis will affect that flow. So we want to make sure that they can handle that kind of stress. So especially if they're born C-section, you want to bring them in as well. Again, as I mentioned before, they have no muscle tone. If their atlas is subluxated, they may have trouble turning their head, which will give them problems nursing, which is going to cause problems for the mother. And that is no fun. Mastitis is no fun. If you choose to give them formula, they may have a reaction to the chemicals in the formula. They may develop colic, which is also no fun. They can't communicate at all. So whether they're happy, if they're sad, if they're hot, if they're cold, if they're hungry, if they're thirsty, if they need their diaper changed, it's all going to sound the same. It's, if you can imagine how extremely frustrating it is to be completely dependent on someone without being able to communicate with them. That is probably one of the most incredible emotional stresses that I think anybody can deal with, baby or not. And as they learn, they put everything in their mouths. I recall telling my firstborn not to lick the electric socket, things you never thought you'd say to a child. Diaper changing, car seats and strollers, these will happen definitely more than once a day. And that's a very obvious physical stress on their spine. Circumcisions, my lord, I'm glad I'm a girl. Teething, girl in America. Teething, vaccines. I think the number now is about 72 vaccines by 14 or 18 years of age. It's a huge chemical stress, regardless of your stance on vaccines. It simply is a chemical stress. As they're learning to walk, learning to talk, learning to potty train, communicate, bathe themselves, feed themselves, as happy and as exciting as these are, if you can imagine yourself having to relearn these things, it would still be as exciting as it is very stressful. Their growth spurts, they're going to grow so exponentially fast from birth to 5 years old. And starting school, socializing, and again, sitting at a desk from such a young age all the way through school. And siblings. If they have siblings, my goodness, if you felt all that stress, wouldn't you want an adjustment? Because I know I would. So my suggested hair plan for pregnant ladies is ideally you want to come in to get adjusted once a week. I have wellness packages where you can save per visit. You can give me a call and I can have someone share some deeper information. And of course your baby's first adjustment is included in your care. The ICPA website that you see on the screen, icpa4kids.org, is a website with some great research, chiropractic research, wellness research. And if you are not in the Brooklyn area and you want to find a pediatric chiropractor, you can find one that is certified in the Webster technique on that website. And I'm going to end with this slide here, which is my vision for the future. If you have watched this till the end and you have an appointment with me, I'm going to ask you about the slide to make sure that you watch the whole video. So I'd like you to come in and share with me your vision for the future. My vision is a community of sustainable living where we're able to respect ourselves, respect for nature, respect for women in our community who are the sacred vessel that brings life into this world. We can learn from our children. I find that having children is probably one of the greatest learning experiences I've ever had, not just for myself as far as patience, but also in letting go and not holding grudges. If you ever see kids playing at the playground, they love to play so much that even if they fight with each other, they are still friends like 5 minutes later. It's a really wonderful, eye-opening experience. And my coach, Kevin Donka, gave me this great quote. The world thinks that adults produce children, but really it's the other way around. Ralph Waldo Emerson. A sense of connection and balance within ourselves, with each other. Everyone does what they're meant to do. If you can imagine, everyone who is properly aligned in their physical body could be properly aligned in their purpose in life. And when people are aligned with their purpose, how can one be suffering from any kind of depression or anxiety? I mean, even if you overcome obstacles or deal with trials and tribulations, when you know you're on that right path, then every step is a joy. So I like to think about encouraging people to develop their unique talents within ourselves and within each other. And I think that's one of the benefits of this coronavirus pandemic that we're in, is that we kind of have that wake-up call. We have that time to really think about it and pursue it. And strength, economic strength, emotional strength, physical, spiritual, and mental strength. We can help ourselves and we can help each other. And for me, I feel chiropractic is an essential part of that. So, thank you so much for watching. I hope you weren't too bored. I hope it was enlightening for you. And I look forward to hearing from you. And oh, this is our old phone number. So the new phone number, if you need to give us a call, is 718-855-4850. Okay? Thank you so much for joining me, and let me know if you have any questions or concerns, and I look forward to serving you.